Lesson 5 is on sudden illness. The first topic is shock. Any serious illness or injury can lead to shock, which is a life-threatening condition. Signs and symptoms of shock include restlessness or irritability, changes in level of consciousness, pale, ashen, or grayish, cool, moist skin, rapid breathing and heartbeat, excessive thirst, nausea, or vomiting. Call 911 immediately and then have the person lie down if possible. Control any bleeding if necessary. Cover the person with a blanket to prevent loss of body heat. Do not give the person anything to eat or drink, even if the person complains of thirst, and reassure the person until EMS personnel arrive. We're going to skip past this because this was covered in the CPR section. And we're going to go to our next topic, which is breathing emergencies. So signs and symptoms of breathing emergencies include no breathing, shortness of breath or trouble breathing, being unable to talk without stopping for a breath in between every few words, and changes in breathing rate, depth, or rhythm. Other signs and symptoms include gasping, wheezing, gurgling, or high-pitched noises, changes in skin color, temperature or condition, dizziness or lightheadedness, chest pain, and apprehension or anxiety. If a person is having trouble breathing, determine whether to summon EMS personnel. Help the person to rest in a comfortable position. Sometimes sitting and leaning forward slightly can help to make breathing easier. If the person is finding it difficult to talk, phrase questions so that they can be answered by nodding or shaking the head. In addition, you can offer to help the person with his or her medication, such as an asthma inhaler or an epinephrine auto-injector, if appropriate. And those will be things we cover later on in this module. Continue to watch for changes in the person's condition and be prepared to give CPR if the person becomes unresponsive. And here's a good video on asthma, which is our next topic.
People with asthma may have difficulty breathing when they are exposed to certain substances or conditions called triggers. Common triggers include exercise, temperature extremes, air pollution, strong odors, allergies, respiratory infections, and stress. Exposure to the trigger causes the airways to swell and become narrower, making it harder for air to move in and out of the lungs. Signs and symptoms of an asthma attack are similar to those of any other breathing emergency and include wheezing or coughing, rapid shallow breathing or trouble breathing, being unable to talk without stopping for a breath in between every few words, anxiety and fear, sweating. A person with asthma can minimize the frequency of asthma attacks by avoiding triggers and taking prescribed long-term control medications. But when an attack occurs, prompt action is needed to open the airways and restore normal breathing. The person will most likely have a prescribed quick relief or rescue medication to use in the event of an asthma attack. Encourage the person to use his or her quick relief medication as directed by his or her healthcare provider, assisting if needed and state or local regulations allow. Call 911 or the designated emergency number if the person's breathing does not improve within 5 to 15 minutes after taking the medication, or if the person becomes unresponsive. Monitor the person's condition until the person is able to breathe normally or until help arrives.
So a person with asthma may take a quick relief rescue medication to stop an asthma attack. These medications work quickly to relieve swelling, opening the airways right away, and are often administered through an inhaler. If the person requests your help, you can shake the inhaler, remove the mouthpiece cover, and attach a spacer if used, and give the inhaler to the person and advise them to use it as directed by his or her healthcare provider. If the person's breathing does not improve within 5 to 15 minutes, call 911. If the person becomes unresponsive, make sure that 911 has already been called and begin CPR immediately. Our next topic is on anaphylaxis, and we have a video to start.
Anaphylaxis is a severe allergic reaction that can develop within seconds or minutes of being exposed to an allergy trigger or allergen. A person who is experiencing anaphylaxis may have trouble breathing and go into shock. Because anaphylaxis is life-threatening, it is critical to act quickly to stop or slow its effects. To recognize anaphylaxis, look at the situation and the person's signs and symptoms. If you know that the person has been exposed to an allergen, look for trouble breathing or signs and symptoms of shock. Remember that signs and symptoms of shock may include excessive thirst, pale, cool, moist skin, changes in level of consciousness, and a rapid, weak heartbeat. Unknown exposure plus trouble breathing or signs and symptoms of shock equals anaphylaxis. If you think the person may have been exposed to an allergen, look for any two of the following signs and symptoms. Any skin reaction, such as hives, itchiness, or swelling. Swelling of the face, neck, tongue, or lips. Trouble breathing. Signs and symptoms of shock. Nausea, vomiting, cramping, or diarrhea. Any two of these signs and symptoms, in combination with suspected exposure to an allergen, equals anaphylaxis. If you do not know whether the person has been exposed to an allergen, look for any skin reaction or swelling of the face, neck, tongue, or lips. If the person has a skin reaction or swelling, and the person is having trouble breathing or showing signs and symptoms of shock, then assume anaphylaxis. When you recognize that a person is experiencing anaphylaxis, have someone call 911 or the designated emergency number immediately. If the person has a prescribed epinephrine autoinjector or an autoinjector is available and you are authorized to use it, help the person use the autoinjector. When administering an epinephrine autoinjector, be sure to hold the leg firmly during the injection to limit movement of the person's leg. Remember that anaphylaxis is a care-first situation, so if you are alone, help the person first and then call 911 or the designated emergency number. While you wait for help to arrive, make sure the person is sitting in a comfortable position, or have the person lie down if he or she is showing signs of shock. Provide reassurance. If the person is still having signs and symptoms 5 to 10 minutes after the first dose, and emergency responders have not arrived, help the person administer a second dose if another autoinjector is available.
So some review. Epinephrine is a drug that slows or stops the effects of anaphylaxis. A lot of times it'll be administered in what's called an EpiPen form, and they look like this. If a person is showing signs and symptoms of anaphylaxis, have someone call 911 immediately. Help the person use medication for the emergency treatment of anaphylaxis. Make sure the person is sitting down in a comfortable position, or have the person lie down if he or she is showing signs of shock. If you are alone, help the person with the medication and then call. Our next topic is diabetic emergencies. So this is a common one in the care home. As you know, diabetes is a condition that makes it difficult to regulate blood sugar. Signs and symptoms of a diabetic emergency include dizziness or shakiness, headache, cool, moist skin, changes in behavior. You might notice residents become irritable, aggressive, argumentative. They might have confusion or disorientation, loss of consciousness, seizures, or both. If the person is responsive and able to safely swallow, give 15 to 20 grams of sugar. Check the label on packaged products to determine how much of the package's contents to give. Some good forms of sugar are candies, fruit juices. You could do soda, milk, or even sugar mixed into water. Call 911 if the person is or becomes unresponsive, if the person cannot swallow, if the person does not feel better within about 10 to 15 minutes after taking sugar, or if you cannot immediately find a source of sugar. Our next topic is seizures. To care for a person having a seizure, let the seizure run its course. Remove nearby furniture or other objects that could cause injury if the person hits them during the seizure. When the seizure is over, check the person for responsiveness. If the person is responsive, check them from head to toe and place them in the recovery position. So remember that head to toe check, and the recovery position is pictured here. Stay with the person until he or she is fully recovered and aware of his or her surroundings. Call 911 if the seizure lasts more than 5 minutes or the person has multiple seizures, if the person was injured as a result of the seizure, if the person is unresponsive after the seizure, if the person is pregnant or has diabetes. In addition, you should call 911 if the person is a young child or if the person is elderly. If the person's first seizure or the cause of the seizure is unknown, or if the seizure took place in water. Our next topic is fainting. So as you may have seen around the care home, a person who is about to faint may become pale, begin to sweat, complain of dizziness or weakness. You may be able to prevent the person from fainting by having the person sit down and put his or her head between his or her knees, or lie down flat on his or her back. If they do faint, and if they're responsive, check the person for injuries that might have happened as the result of the fall. Put the person into the recovery position. Call 911 if there is any doubt about the person's condition, and have the person follow up with his or her healthcare provider. If the person is not responsive, begin CPR immediately. Our next topic is stroke. So some signs and symptoms of a stroke include trouble with speech and language, including slurring of words, being unable to form words, or being unable to understand what others are saying. In addition, drooling or trouble swallowing, drooping features on one side of the face. A lot of times it's the eyelid in the corner of the mouth, and trouble seeing in one or both eyes. Weakness, paralysis, or numbness of the face, arms, or legs, especially on one side of the body. A sudden severe headache, dizziness or loss of balance, confusion, unresponsiveness. We have a video here explaining stroke.
If you think someone might be having a stroke, conduct a FAST check. F stands for face. Ask the person to smile. Does the person's face look uneven, or is there drooping or weakness on one side? A is for arms. Ask the person to raise both arms in front. Does one arm drift downward or appear to be weak? S means speech. Ask the person to repeat a simple sentence, such as, "The sky is blue." Does the person have trouble speaking, or are the words slurred? T equals time. If the person has trouble performing any of these actions, or shows any other signs and symptoms of a stroke, note the time that the signs and symptoms started and call 911 or the designated emergency number immediately. When a person is having a stroke, every minute counts, so act fast.
So some review: face, arm, speech, time. Ask the person to smile. Is there weakness or drooping on one side of the face? Arms. You could ask the person to raise both arms. Does one appear to be weak? Speech. Ask them to repeat a simple sentence. Are they having trouble with that? And time. If they're showing any of these actions, call 911 immediately.